Hello, I'm Dr. Inman. I'm the frequency-specific laser guy. A lot of you know me. We've been developing techniques for applications for dog, cat, horse, and human for the last 20 years. And this is a small video on disc and disc-related diseases, also lameness associated with disc disease conditions. If you only use a laser for one thing and one thing only, and that's to treat disc-related disease, spinal problems, and lameness associated with disc disease, then this device basically will pay for itself weekly for the rest of your life. It is incredibly an important methodology and a tool for us to direct healing towards these tissues. Disc conditions have been treated for the last 100 years by chiropractors, and that's fine. We also direct ourselves to an adjusting technology where we go through and we actually reset these vertebral segments with a spinal accelerometer, that technology called veterinary orthopedic manipulation. That methodology has been around and it's effective. Another way for us to actually reset the neural interference that's causing this condition is to use a frequency-specific low-level laser therapy. Now, the important part about using this technology as opposed to devices that we've used before that can only deliver 4 frequencies is we can deliver about 16 different frequencies in one 60-second pulse of about 300, anywhere from 250 to 375 milliwatts with this instrument. So we flip it to, in this case, disc disease general, and flip it on, and then we start lasering the spine. And it isn't any more complicated than this. Now we can do about 60 seconds is all it takes for us to do this, and we can scan it up and down the back, and we can put it at a specific area if we're concerned about it. We can be this far away and get the whole back at one time. We can also do the horse and be this far away and basically do the horse or the cat, or we can do the sacroiliacs, or we can do the human being too. We can do the human being in just exactly the way that you think we should do it, either from the front or from the back in this regard. This particular laser delivers frequencies that rehabilitate the actual cells that are holding the problem in place. This device is also an infrared laser that can basically remove pain. We don't use it that often, but there can be pain so severe that the client, human being, is screeching in pain and goes to their chiropractor or to the emergency room. And you've seen people that have had that condition. Very commonly, people in their 40s will generate that kind of back pain. Finally, it'll creep up on them, and it's incredibly painful. We can use the infrared version of this laser to take them out of pain in a couple of days. However, in a couple of minutes, rather. But after a couple of days, it's not that much more effective because all we're doing is producing vasodilatation. When we use the red part of this laser only, essentially, to communicate to the cells, the mitochondrial DNA of the cells that are going to resolve the problem, we not only take care of the pain, which takes another 10 minutes after we laser them, as opposed to the infrared, but also it basically treats the oligodendrocytes, the anesiodendrocytes, the Schwann cells, the nerve roots, the interneuronal area that's holding the condition of neurological subluxation in place, plus also vasodilatation, blood supply in, venous supply out, and lymphatic drainage, along with other series of frequencies such as 425 and 25, which actually block the pain gates specifically. And so what we do with the laser in 60 seconds is we're able to not only address the pain problem, but also rehabilitate the function of the body to fix the problem. So it's imperative to understand that we're not fixing the animal, we're not curing the animal. What we're doing is we're allowing the person or the animal to actually heal themselves by inducing the cells that would ordinarily be treating that condition and resolving the problem, and we're inducing them to actually do what they're supposed to do. Again, this particular device there's 3 different disc conditions. There's a bunch of spinal ones, there's a bunch of lameness ones. One I like to use a lot in chronic conditions is I like to use one that's called degenerative myelopathy, which basically is kind of like a shotgun approach to just about anything in the spine, and it works very well. Sometimes also we use fracture non-union, which seems to be an effective approach to treating acute and or chronic spinal problems, particularly in the back of the dog, the cat, and the human being. Works particularly well in the cervical vertebra also of the human being. This device basically has, those are about 5 of the 1,800 different protocols that exist in this device that are pre-programmed into this device, and you can get this device. The manufacturer will sell it to anybody. Unfortunately, it costs around $7,600, but it should pay for itself in a week in clinical practice, and it does. Essentially, we've sent home about 700 of these, and actually 657 of them, and none of them have come back in the last 2 years because they all work, and they all basically solve the problem. So if you have any questions or problems, or want to consider an application technology using this device, or if you're interested in this device, contact me at drbill@vomtech.com. That's VOMTECH.com, or contact me via phone. I'll be happy to chat with you on cases or about the applications of this device in conditions involving the spine of the dog, cat, horse, and human, essentially. And you can contact me, area code 208-640-3430. That's 208-640-3430. I'm retired here in northern Idaho, and all I do is talk on the phone to my docs and the people that I've trained to use this instrument. So thank you very much for your patience, and have a great day.